On this skull, you can see the nuchal crest is this highest point of the occipital bone right here. Turn the skull. You can see it there. So that's the highest point on the horse's head, and it's susceptible to fracture in horses that are rearing up in confined spaces. Here's the nuchal crest on an older animal. You can see it right here. Comes up to the highest point of the skull. Down right through there. Very pronounced structure. It's an older animal, better developed. The nasal bone is this bone here. Comes all the way down to the tip. So the rostral process of the nasal bone is this piece here that is not supported ventrally by any other bone. So this rostral process is susceptible to fracture by things pushing down on the dorsal aspect of it. And because this nasal bone is not laying right down along our incisive bone here, we have a space in between the two, and this is the nasoincisive notch. And that nasoincisive notch, this caudalmost aspect of it, will be used to approximate the location of our infraorbital foramen in the live animal. The facial crest is this ridge of bone right here. It projects from the zygomatic bone here and the maxillary bone right here. And as we will see later in a dissection, there will be a vein running right here up underneath it that you will tap into to collect small blood samples for hematocrit. Okay, the infraorbital foramen, that is this opening right here. It's the rostral opening of the infraorbital canal through which your infraorbital nerve is passing. And it is located on a line halfway between the nasoincisive notch and the rostral end of the facial crest. Make a line right there between those 2 points. About halfway down that line and about a centimeter or 2 caudal to that, that's where that opening would be, and you can see it lays just slightly caudal to that line between those 2 points. Here is a closer view of our infraorbital foramen. There's the back end of that nasoincisive notch here, front end of our facial crest here, and if you approximate that line between the two, halfway down that line, just caudal to it, there is our foramen. The zygomatic process of the frontal bone is a ventral projection of the frontal bone that joins the zygomatic arch. That is this piece right here. The dog did not have that. The dog had an orbital ligament there joining that frontal bone to the zygomatic arch. So this structure will complete the bony orbit of the eyeball, providing protection 360 degrees around that organ. The supraorbital foramen is located over the orbit in the base of that zygomatic process of the frontal bone. So right as that's coming off, it's located in the base there. And if I tilt this down, you can see that opening right here. The zygomatic arch is a bonic structure extending caudally from the eye, so it starts here and comes out this direction. Now the dog, we talked about this whole piece being an arch, but there was no bony union here, so this is our bony orbit. So in the horse, the arch is just this caudal part of what the dog had. So it extends caudally from the eye, and it is this structure right here. Here's a different look at that zygomatic arch. Here's the highest point here. The mandibular foramen is on the medial side of the ramus of the mandible. So if you look in here, here it is over there, medial side. So its location is approximated by the intersection between two lines. One line will lay here from the lateral commissure of the eyelids down to the angle of the mandible. The other line, a horizontal line through the cheek teeth and that location. So that gives us a point about here. And if I put my finger back here, it's right here. So it gets you close enough to that mandibular foramen using that approximation to stop, begin dropping nerve blocks down there that we'll talk about in a moment. The notch for the facial vessels is an indentation along the ventral aspect of the caudomandibular body, ventral to the last cheek tooth. When we talk about ventral to last cheek tooth, I just see 3 in here. 1, 2, 3. This horse has more teeth that need to be coming in, so there will be some molars back here, farther back. But the notch for the facial vessels will be this point right here. And that's where the facial artery swings from the ventral aspect of this horse head onto the lateral side, and it will lay subacute that point. And a pulse may be taken from the facial artery at that point there. The mental foramen is an opening on the lateral mandibular body, halfway between the corner incisors and the first cheek tooth. So the corner incisor is going to be right here, first cheek tooth right here, halfway between. There is our mental foramen at that point. The infraorbital nerve is blocked as it exits this foramen on its way to relay sensory information from the nose and the upper lip back toward the brain. Okay, and getting a closer look at that supraorbital foramen. There it sits in the base of that zygomatic process of the frontal bone, and the supraorbital nerve can be blocked at that location, and that will stop sensory innervation from the upper eyelid. Here's a close-up of the mental foramen located there, halfway between our corner incisor and our first cheek tooth. The mental nerves will exit here to supply sensory innervation to the lower lip. So blocking that nerve at that location will block out that sensation. If you want to block out the sensory information from your lower incisors, you would take your needle and you would advance into that foramen. If we take a look at our zygomatic arch here, it arches up and back down. The auriculopalpebral nerve can be blocked as it crosses the highest point of that arch, that point there. So palpate the arch, feel for the highest point of it, and that's where you will drop your nerve block for the auriculopalpebral, and that will block motor function to the upper eyelid.